Hi, Dr. Gayner, Gayner Facial Plastic Surgery. Welcome back. Last week I talked a little bit about face lifts, neck lifts, cheek neck lifts, i.e. don't get caught up in what they're called. Rather ask your surgeon, what are we actually doing? Because they're all kind of the same no matter if we name them after ourselves or the community we're in, etc. So a cheek neck lift involves treating the neck, and usually people have a little bit of fat here, so we'll make a tiny incision under here and do liposuction in the office. And younger people will do liposuction as a standalone procedure in the office, and they get a nice result. As we get a little older and the muscles and skin sag, those patients aren't as good candidates for just lipo. So again, a cheek neck lift usually will involve removing some fat from the neck area through a really tiny incision. Then the fun begins. So we have to make some incisions around the ear to lift the skin. This is a patient of mine. I'm just going to trace out where we made these incisions. So a little bit into the temporal hairline along here behind that little piece of cartilage called the tragus in the natural crease between the earlobe and the cheek. Then we go real stealth and we go up the back of the ear and into the hairline. So up close you say, boy, it's really hard to see those incisions. And that's the point, is we want to have really stealthy incisions. Then we lift the skin up. Now 50 years ago, a neck lift was then just pulling on that skin to get a lift. And those patients did okay, the results were okay. The scars were pretty wide because the whole load of the lift was on the skin. So everything that was being held up was by the skin. So those incisions tended to become kind of wide. Then somebody got smart and said, there's this really great hardy layer of tissue underneath the skin, and we can put sutures in there and lift that up and the skin will just come with it. So that burgeoned in the late 60s, early 70s, the kind of modern era of facelifts. And so that's what we do now. We simply take a suture and we put it in a lower point in this tissue, and then in the upper, and as I say, tie the knot, things head north. And that's what it is. So it's a face or cheek neck lift. We're not pulling, etc. We redrape the skin, we remove the skin, we sew it up. I don't put drains in, etc. But any lift that you have is going to have some component of neck improvement with liposuction. We're going to make incisions around the ear. We're going to lift skin up. We're going to use sutures to bring that muscle layer up. We're going to redrape skin. We're going to remove skin. We're going to sew you up. We're going to put bandages on, and that's it. I do mine across the hall in a little surgery center. We do it under a little IV sedation, and it takes me about an hour. And again, when we look at results, it's about the neck. So I'm not lifting the face, I'm lifting the neck. People say, what's a full facelift? I go, I don't know. I think it's a component of doing a cheek neck lift, then maybe adding eye surgery, blepharoplasty, could be a brow lift, etc. But a cheek neck lift is just as I described. And again, the business end, as I say, is down in the neck. So we get these, this is the day after, pretty nice. So my patients convalesce quite nicely, week to 10 days of social downtime, and then they're back at it. And again, to go from there to there isn't Botox, fillers, etc. It's a little bit of a neck lift. So hopefully I got you a little education on what these things are and how we do them, etc. So have a great weekend.